My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to talk about is swelling bad? This is a question we get asked quite often. It came up twice tonight, so we are going to do a little video on that. Before I begin, I want to tell you this is swelling associated with the joints. This is swelling associated with joint pain, maybe in the muscle. This is not swelling associated with an allergic reaction. So if you think this is an allergic reaction swelling, you call 911. This is not anything to do with that type of swelling. This is more of a muscle pain. This is more of a joint pain. This is when to pay attention to swelling that happens either in the knee or the ankle or the hip or wherever you're seeing swelling, in the hands a little bit. But this is not concerning swelling in the face or some type of allergic reaction you think you might be having. That is a serious medical event. You need to call 911 immediately. So just to get that out of the way. So when we're talking about swelling, we talk about it a lot in here because we do see our fair share of post-surgical patients, patients who've had a traumatic injury, and sometimes that swelling that randomly appears and you've had nothing. So is swelling bad for you? No, it really isn't. What happens is swelling is just kind of increased blood flow going to the joint. It means there's something going on there. It means there's something in the muscle that's going on there. A lot of times people after surgery get very concerned about the swelling that they see in their knee or in their ankle that continues to go on. My recommendation and what I usually tell people following surgery is swelling can go on from 6 months to a year post-surgery because of the fact that when you do something new, whether it's walking, if you've got a limb on that's operated, your ankle or your knee, if you walk too much, if you stand too much, anything you change in your daily routine, which you're going to do as you progress your exercise program, as you get better from your surgery, you're going to be able to stand longer, you're going to be able to sit longer, whatever it may be, you're going to wind up with more swelling. So it is just more of a change in how much blood is going to that joint. You're working a little bit more blood's going to go to the joint. So that's not a bad thing. It just means that there's a change in what is happening. You want to pay attention for the fact that maybe the swelling has gotten 10 times bigger. That's when you kind of have to raise a red flag saying maybe I re-injured this, maybe it's a little something more than just changing my activity. When you do experience swelling, you want to keep moving. The best thing to do for swelling is to actually get the motion going, to get the movement, to get that joint moving, to get that muscle moving. It may not be a run that you need to go on. It could be just some gentle walking or just some gentle motion, like an arm, swing, or, just bending and straightening your leg, or moving your ankle all around, allowing some of that swelling to get out of there. Ice is always a really good one for swelling. But don't be alarmed if you are post-surgical and 6 to 12 months later, you're still seeing some swelling. That's totally normal and that's totally fine. It is not abnormal to have that happen at all. You just want to pay attention to something where it's like, 2 or 3 times the joint size. That means there's something going on. But you will notice throughout the entire rehab process, as you're rehabbing from surgery, that you're going to get a little bit of swelling. That's totally normal. What about swelling that happens that's not a part of surgery? Let's say you woke up and you're like, oh, my knee is a little swollen, or you sprain your ankle, you get a little bit of swelling there, or you just woke up and your fingers are a little bit swollen. You didn't do anything. Again, totally normal. What you want to pay attention to is there pain associated with that swelling? So swelling could be a number of different things. Doesn't necessarily mean injury, but it could be there's some pain there. And a lot of times what happens is when somebody notices swelling, it clicks like, oh yeah, I was limping on that, or I did some more walking on that, or my hip was bothering, but now my knee is swollen. Anything that's connected to one another. So for example, if you've got a little swelling in your elbow, but you felt some shoulder pain, that could be coming from your shoulder. So it could be indicative of some problems that are going on. If you haven't injured yourself and you have some swelling going on, it is worth getting checked out. And we do offer free consultations. If you want a doctor of physical therapy to take a look at you for free, all you have to do is call our office at 215-997-9898, and we will go ahead and do that. But if you do notice some swelling that hasn't been associated with an injury, but you notice pain in other areas, let's say your ankle is swollen, but you have knee pain or you have hip pain, generally you're going to start limping and you're going to start guarding a little bit. And it's nothing that you're doing that you're going to know you're doing. It's something that happens naturally in the body. So it's very common for you to have swelling in other areas of your body that are very affect other areas. So if you feel pain in your shoulder but you get swelling in your hand or your elbow, get that checked out. That means there's something going on and it's actually really causing some issues. Swelling can get so bad it will start to affect the range of motion, and that's when you really need to pay attention to it. Not that you should ignore it prior to that, but if you have no injury, you have no pain, and all of a sudden you have swelling and it's beginning to affect that range of motion, you really need to see somebody about that. That's concerning. If you have pain but no real injury, like you didn't fall or anything traumatic like that, but you notice swelling, again, you have to get it treated. First of all, because swelling can cause restriction in range of motion. So, I would just work the joint a little bit, meaning just do some arm bends, straightens, overheads, whatever, allowing that swelling to move out of the area. Do some ice. If that doesn't help it, or you notice that it's increasing, or you notice the pain is increasing, you want to get help from that as soon as you possibly can. And again, if you want that free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we will look at it. Now, if you have swelling after a traumatic incident, you fall down the steps and your knee is swollen, or you sprain your ankle, we always get lots of pictures of very interesting ankle sprains based on the amount of swelling. It can look really, really hideous. So that's normal, obviously, when you sprain your ankle. The best thing you can do, again, for swelling is movement. So you want to move that ankle all around. If you sprain a finger, you want to move it. Gentle range of motion only. Don't jam it in. Don't force your ankle to move. But, even if it's just a little bit up and back, that's going to help that process of getting the swelling out of there. You don't want a swelling that's going to affect a range of motion. A lot of times when you have a sprained ankle, the amount of swelling is actually going to affect the range of motion. If you stove a finger, jam a finger, whatever terminology you may use, it's going to get all fat and you're not going to be able to use it. What you want to do is you want to gently bend it and keep bending it and keep bending it. Work that range of motion, okay? So if those traumatic injuries that produce swelling where it's not a fracture and nothing has been torn like a ligament, one of the easiest things that you can just start doing at home, nice and easy, is start moving it. Now, if you move it and it's extremely painful, or you move it and nothing is happening and you can't get that range of motion back, you've probably torn something. You've probably fractured something. That's when you really need to actually go and get that issue addressed. But all in all, swelling is not a bad thing. It's just fresh blood being brought into the area. It is important that you do range of motion exercises to get that out. It's important that you do ice to help it along. But the two questions we were assessed tonight were post-surgical candidates. That could take 6 to 12 months. Again, don't ignore it. Don't just say it's going to go away, because it's probably not going to go away on its own. But doing just an easy range of motion exercise and some ice can help get rid of that swelling and prevent any future loss of range of motion or any future issues. If you do have pain and you want a doctor of physical therapy to take a look at it for free, we do offer free consultations. All you have to do is call our office at 215-997-9898, and we will be in touch. Thanks, and have a good night.